Hi, my name is Dr. Jedrzejewski, and I'm here today to talk to you about body contouring for masculinization. Our initial consult will be either over the phone, through video, or in person. We'll talk about what to expect in terms of the operation, but we'll also talk about how to best prepare for your operation beforehand and how to optimize your recovery afterwards. We'll review your medical history thoroughly. I want you to be as transparent as you can regarding your medical and social history so that we can address your specific concerns and work with you to move forward to surgery in the safest way possible. My number one priority is to ensure your candidacy for a safe surgery and to optimize your surgical outcome. This means we need to minimize issues such as wound healing, bleeding, adverse reactions to anesthesia, and other complications. So starting off with bleeding, we'll look at your medications to make sure that you're not on any medications that place you at an increased risk of bleeding intraoperatively. This means NSAIDs like aspirin, ibuprofen, naproxen. These medications we'd want to stop about a week before surgery to reduce your risk of bleeding. If you take Tylenol, that's okay to continue taking. In terms of smoking or using nicotine in any form, such as vaping, it's best to avoid this 6 weeks prior to surgery and 6 weeks following surgery. We ask you to do this because nicotine constricts small blood vessels that we rely on to help you heal from your surgery. In terms of weight, I don't have a BMI cutoff for body masculinization surgery. But it's important to note that the higher your BMI, the higher chance you're going to need a revision surgery, the greater chance you'll have problems with anesthesia. And if you have any comorbidities like heart or lung problems, then these need to be either resolved or optimized by your primary care physician prior to surgery. A stable weight, like 3 to 6 months before surgery, will yield the best aesthetic outcome. If you have type 1 or type 2 diabetes, we'll need to get a recent A1C level to make sure that your blood sugars are in a level that's safe for surgery. High blood sugar levels can lead to problems with wound healing and increase your risk of infection. Autoimmune diseases often require medications like steroids, which can inhibit wound healing. So we'll want to take a look at any medications you take for any autoimmune conditions. If you have HIV, we'll want to make sure that your CD4 count is appropriately high and that your viral load is appropriately suppressed. If you have any personal history or family history of blood clots or adverse reactions to anesthesia, we'll want to know about those so that we can help keep you as safe as possible during your procedure. I'll want to know about any allergies that you have to any medications or foods or other drugs. I'll want to know about the prior surgeries you've had, especially any scars you have in the abdomen or history of infections or prior implants or silicone injections anywhere. We might have to get a CT scan, which is an imaging of the soft tissues of the inside of your body if you have a history of hernia or any abdominal operations. In terms of social support, surgery is a physiologic stress on both the body and the mind, and social support is incredibly important. It's not uncommon to have feelings of negativity, depression, or anxiety postoperatively, and studies have actually shown that the strength of one's social support network can significantly enhance recovery after surgery. Everyone's social support might look different, whether it's family or friends or chosen family or your mental health provider, but it's important to have a plan in place for who's going to support you as you recover from surgery. If hormones are a part of your gender expression, it's best to wait about a year after initiating so that the majority of fat redistribution has occurred. This allows for optimization of contouring and reduces the unpredictable nature of tissue deposition. Before moving on to physical exam, I want to know what your goals are. Body masculinization can be a highly individualized surgery. My goal is to help you fulfill your embodiment goals and to tailor your operation to align with your gender expression. The most popular procedure for body masculinization involves removal of fat from the butt, the thighs, and the hips, and in some cases, maybe the abdomen and flanks as well. Our goal is to create a waistline to hip ratio which is closer to 1, which means a more streamlined, rectangular, and culturally considered more masculine look. This can be done in addition to other procedures such as top surgery or abdominoplasty or tummy tuck, or a brachioplasty if you have excess tissue and skin of your arms. Silicone implants may come into play for patients interested in pectoral implants. This may help the chest look more muscular or less flat. These will typically be placed under the muscle. If you've had top surgery with inframammary fold incisions in the past, then we would use those incisions to access the pocket for these implants. The risks of body contouring surgery are similar to any surgery, including pain, infection, scar, including hypertrophic and keloid scars, asymmetry, contour deformities, dog ears in the case of abdominoplasty. This means extra tissue bunching up on the sides of your incision, hyper or hypopigmentation, dehiscence, which is separation of your incision, delayed wound healing, which can follow dehiscence, numbness, hypersensitivity, bleeding. There's a 5% chance that you'll have bleeding that would require a return trip to the operating room. You can have a collection of blood, otherwise called a hematoma, or a collection of fluid your body makes anytime you make a space that wasn't there, called a seroma. These usually resolve on their own, but sometimes they might require intervention. There is a risk of damage to surrounding structures. That is the nature of surgery. There might be a need for additional procedures, and there are risks of anesthesia, which include blood clots to the legs and lungs and death. There's a risk of regret for various reasons, and we can talk about this more in person, but it's important to know that the existing literature states that the rate of regret for people undergoing gender affirming surgery is less than 1%, which is low when you compare it to other elective non-cosmetic surgeries, such as knee surgery, which has a regret rate of about 10%. The risks of silicone implants include risk of infection, extrusion, which means contact with the outside world, failure of the implant in terms of rupture, malposition, or it could be your desire to take it out later. So there's a risk for desire for explantation. 1 to 2 weeks prior to surgery, we'll have our preoperative visit either over the phone or in person. We will review the surgical plan and you'll receive prescriptions for your pre and post-operative medications for pain and nausea. At this visit, it would be good to see ideal pictures of what you would like to achieve through surgery so we can make sure that we're on the same page in terms of goals and expectations. On the day of surgery, you'll arrive 2 hours prior to your surgery start time at either our surgery center or the hospital, wherever we've scheduled your surgery. You and I will sign a consent saying that we agree on the procedures that you give me permission to proceed with, and I'll do markings on your body before we head to the operating room. Surgery, if you're just having liposuction, lasts about 2 hours. It can be longer, of course, if we're combining other procedures. The first part of the surgery is removing fat through liposuction through 5mm incisions. It's entirely up to you where you want us to remove fat. So that will be some shared decision-making between you and I, in the time that we plan our surgery before the OR. You'll have stitches placed at the incision sites that will be covered with a dressing, and you will have drains in place to remove excess fluid from the operation. Abdominoplasty requires removal of skin in addition to fat, and that incision typically goes low on the abdomen from hip to hip. After the operation, you will likely wake up with some form of compression garment to apply pressure to the correct areas of your body. We inject a long-lasting numbing medication during the surgery, which lasts about 12 hours. There's a small narcotic prescription we provide you with, in addition to scheduled Tylenol and ibuprofen, as long as you don't have any contraindications to these medications. You'll spend at least 1 night with us in the recovery area to make sure you've cleared all the anesthesia and that your pain is under control. If you do not live locally, we ask that you stay in the Bay Area for at least a week following surgery. Immediately post-op, you'll feel very sore. Bruising is normal, and there may be small audible fluid collections, but as long as these are not rapidly growing, it's okay to let them resolve on their own. We'll remove your drains once there is no more than 20 mils per day per drain. It is important to maintain your nutrition during recovery and to minimize constipation with stool softeners, especially while you are on narcotic pain medication. You may start silicone scar treatment once your incisions are fully healed or as soon as 3 weeks post-op. You can buy these silicone scar treatments online. Keep in mind that scars will look red and raised for at least 3 months and then begin to slowly soften, flatten, and lighten over the course of the year. If you begin to develop thick, ropey scars, we can intervene early with steroid injection to help resolve this. Activity restrictions following body contouring include maintaining compression for at least 4 to 6 weeks following surgery. It is okay to take off the compression garment to wash. Lymphatic massage may be helpful in terms of reducing swelling postoperatively, but you should expect to see final results around 6 months post-op. After 2 weeks, you can return to a desk-type job. If you have a more physical job, wait until 4 to 6 weeks until returning to work, unless you can get modified light duty. No submersion of your incisions into water like a bath or jacuzzi until 6 weeks after surgery. If you use nicotine prior to 6 weeks before surgery, you may not resume until 6 weeks after surgery, but hopefully you can use this opportunity to avoid restarting and to improve your overall health. Your scars will take 12 months to fully mature, and it's important to use sunscreen on them anytime they are exposed to sunlight. In terms of follow-up, after the initial postoperative appointment, I will see you at 6 to 8 weeks post-op, and then again at 3 months post-op to make sure that your healing is on the right trajectory. We would love to see you again at 1 year post-op, either in person or virtually, to assess your final result. At the time of the consult, I will answer any questions you might have. If you have questions that arise after the consult, you can always contact our office and we will be happy to provide you with more information. We also encourage you to submit ideal photographs of what you envision for your results so we can make sure we're on the same page at your preoperative appointment. Following the consult, my team will begin the insurance authorization process and will contact you within 2 weeks to discuss timing of surgery. If there are any items that still need to be completed prior to scheduling, like letter of support by a mental health provider, they will let you know. Thank you so much for taking the time to review this consult for body masculinization, and I look forward to meeting you.